I'm Dr. Mike Wasserman. I'm a geriatrician. I'm also Chief Medical Officer for Rockport Healthcare Services, and I'm on the editorial board of the Merck Manual. When I was 9 years old, I decided I wanted to be a doctor. I didn't know what kind. And when I was a third-year medical student, I was seeing a patient every morning. I would wake her up at 4:30. This was in Texas. And she would swear at me and cuss me out because I was waking her up at 4:30 every morning. And on my last day of the rotation, she called me aside and she said, "Doctor," and I was just a medical student, and she said, "I want to apologize to you." And I remember this like it was yesterday. I felt bad that she would be apologizing to me. And I said to her, "Look, you're the patient. You're the one in the hospital bed. You're the one who's sick. It's okay to act however you want to act." And pretty much it was that moment that I knew I wanted to devote my career to taking care of older adults and to go into geriatrics. Geriatrics is so much fun for so many reasons. In today's healthcare world, for a lot of specialties, everything's sort of guideline driven, and you do this, you give that medication, you do this treatment. Geriatrics is like frontier medicine. If I've seen one 95-year-old patient, I've seen one. They're all different, they're all unique. We're trying to deliver very person-centered care, which means we really have to focus on the individual. And so, to me, being a geriatrician is a huge challenge, but it's also incredibly gratifying. I actually liken being a geriatrician to being a chess grandmaster. Chess grandmasters, contrary to popular opinion, aren't so good because they see 12 moves ahead. They're good because they see patterns. And when you're taking care of a frail older person who has 12 problems and multiple social issues, you have to look at the whole person and make determinations that way. And to me, that's arguably one of the greatest challenges in medicine today. The most rewarding aspect of what I do as a geriatrician is getting the feedback from my patients. I've always tried to treat my patients as if they're family or friends. And in fact, every one of my patients, I will literally ask myself, if this were my mother or father, what would I do? And they know that, they feel it. And a lot of my patients over the years call me by my first name. And actually, after I left practice in Colorado, I stayed in touch with a number of my patients and still stay in touch with them. They've become my friends. So I think developing a relationship that is more of a friendship is incredibly rewarding, and I find that older adults are incredibly appreciative of the time and the care that we give to them. I think when you go to medical school, you have certain expectations of what being a doctor is. Number one, I think for most of us, it's about helping people, and we don't think about all the other things. I think in today's world, the hardest thing that most medical students don't get is input or emphasis on the business side, the management side. When I became a second-year resident, I realized that I had 2 interns working under me, and I realized that I was their manager. And I'd never taken a business course, I'd never taken a management course. Here's the reality: healthcare is a business. I don't care what field you go in. There are business aspects to it, and if you ignore those business aspects, I think you ignore them at your own peril. At the end of the day, recognizing the business and management aspects of healthcare are something that I never thought about when I was a medical student, and ultimately have come to define what I've learned and who I've become as a physician. Going through medical school is not an easy process, and I had friends and colleagues who didn't make it. Most of us who go to medical school, maybe all of us, already put a ton of pressure on ourselves. It's easy to just double down on that pressure. The other thing, as a physician, and especially in geriatrics, I've learned that I'm not going to make everyone better. I'm not going to be perfect. Perfection is actually impossible in healthcare. And if we try to be perfect, we're setting goals that are very hard to achieve. Burnout amongst medical students and residents and practicing physicians is a huge issue. I've dealt with it as an employer of physicians, dealing with physicians with drug and alcohol problems. And I think the key things to do are to really focus on oneself, to take some time to take care of yourself. I've become a huge believer in meditation and mindfulness. I'm a huge believer in exercise, even though I have to admit, when I was a medical student, I didn't exercise. I got into exercise once I started practicing. but I think exercise can be very helpful. So I think there's a number of tools one can use to take care of themselves and focus on themselves, partially because as physicians, we tend to care for others sometimes more than we even think about our own self. And if you're married or have kids and family, paying attention to those aspects of your life are also very important. I have a number of hobbies that keep me busy. Number one, I exercise to extremes. I did my first Ironman after I turned 50, and I've done 10 since. And I'm in better shape at 58 years old than I've been my entire life, with the exception of having a few extra aches and pains. But I'm a huge believer in exercise, and that's not only become part of my life, but something I enjoy. I get to talk and interact with other people who do sports and things like that. I also give time to charities. Being a geriatrician, I am very focused on positive aging and the message of positive aging. And so I'm on the board of a couple of organizations that devote themselves to positive views of aging. The one thing that I love more than anything else is I have an 18-month-old grandson who absolutely brings joy to my life and who I recently realized will turn 85 in the year 2100. And so as a geriatrician, I'm hoping to help prepare his world for how we deal with older adults in the next century. Geriatrics hasn't been a priority in medical school education, in residency training, and I think that's a really important issue. There's an opportunity for medical students and residents to really force the system, if you will, to teach them about geriatrics. Those of us in private practice who work in an outpatient setting with older adults, it's the most wonderful experience in the world. I have taken care of patients who have been parts of history. I have taken care of the greatest generation, and it is incredibly uplifting. A lot of these people have done amazing things that have helped us as a society get to where we are. You know, it doesn't take more than a minute or two just to talk to an older person about what they did when they were younger and to hear some great stories, and that also helps you develop your relationship with them. So I think those are some important aspects. I actually have come to believe that the single most important person in how we deliver healthcare is the consumer, the individual themselves. And having tools available for the consumer to educate them, to prepare them, I think is the most important thing I see in healthcare today, and it's one of the reasons I really enjoy being part of the Merck Manual. I believe that health information is a universal right. Medical knowledge is power. Pass it on.